So this is a patient who has cirrhosis, and they're just doing like a screening HCC protocol. But I want to show you, it's a congenital anomaly of the veins. Any thoughts, Victoria?
Is it the Abernathy one?
What's the Abernathy one?
Abernathy is, no, the portal vein is here. There's Abernathy malformation is when you have portal vein is gone. So wait, so I see the main portal vein, I see the SMV. Wait, where's the IVC? Is it the IVC that drains into
so this is the SMV. Vein? So I think the SMV is fine.
Oh wow.
Vein. But then this one is, The
IVC just draining into the main portal vein? Oh my goodness.
No, it's here. It keeps going up. So that's the hepatic. I mean, that's the IVC, right? Up here. And then that drains into the heart right there. Okay, so you're right. Yeah, you're right. Where's the right IVC? Kate or Faisal, any thoughts? Feel free to chime in.
So the main portal vein?
The main portal vein, it's here. So here's the SMV. And then, so that's probably going somewhere here.
So this is just left-sided IVC?
Yeah, so what is it? That was my question when I saw this case. Good. So, so this is the patient with history of biliary atresia, status post OLT. And so there's the variant IVC. So that's what we're going to review. There's a really great article in, I think this AGI. Mm-hmm. I forget. The citation is at the bottom of the screen. Anyways, there's different types of variation with IVC. So you can have a malrotation. So in this case, you have a left-sided IVC that drains into the renal vein, which is not what this is, or I don't think it is. You can have a duplicated IVC. Here we have no IVC on the right side of the aorta. The other variation is you have what they call azygous continuation of the IVC. So you have the IVC and there's no communication between the suprahepatic IVC that drains into the heart versus the infrahepatic, because it's draining into the azygous, which then empties into the SVC. And then there's this is the complete absence of IVC, which is what I think this is. So we have the suprahepatic IVC, which we can see, and then you've got, and I think that this is probably maybe a left renal vein, maybe that's like emptying into or like just a prominent gonadal vein that's emptying into the renal vein that then crosses over. So my guess was either this, like a complete absence of IVC, versus a left-sided IVC. But I didn't think it was a left-sided IVC because the iliacs didn't drain into that like prominent vein. Let me go back to the case. So so here is I think it's just like a collateral, because you see all these collateral posteriorly along the posterior wall, and like all this. Here's the renal, and so I think it's right there. So there's the renal, right there. Is that right? What do you think?
Yeah, it looks like a gonadal, right?
Yeah,
I mean, when it went right into the left ovary.
Yeah, so
it's pretty cool.
My suspicion is it's a complete absence of IVC with just, like drainage, sort of collateral drainage of the lower extremity and abdomen. So that's one case.